In podcast episode number 68, I talked to Adele Fanning from Ireland about the athletic shoulder. Adele is the lead upper limb physiotherapist at the Sports Surgery Clinic in Dublin. As part of her PhD, which she finished in 2023, she has published several papers about return to play after glenohumeral stabilization. When we talk about the sporting shoulder, Adele is mainly talking about traumatic shoulder dislocations from sports like rugby, Gaelic football and hurling, but also rotator cuff injuries like tendinopathy and tears in throwing sports or sports like swimming. Next to those pathologies, slap lesions and biceps tendinopathy as well as acromioclavicular joint issues are common in athletes as well. When talking about scapular dyskinesis, Adele reaffirmed what we already learned from other podcasts with shoulder experts, namely that the scapula is often compensating for a rotator cuff that is not functioning very well. Also, Adele stressed that if you target one, you'll automatically target the other, as almost every exercise targets both the rotator cuff and the scapula. She recommends to lower the load on the scapular muscles by changing body positions, for example from standing to a 4-point kneeling or to wall slides if the patient is struggling. We further touched on the kinetic chain. Adele explained that in lots of sports the power comes from the lower body, so she first screens the lower body muscle performance with the help of force plates. Further, Adele views the kinetic chain as a way to facilitate local recruitment, as a systematic review by Richardson et al. Has shown that integrating the kinetic chain can increase axioscapular recruitment, produce lower trapezius muscle ratios, and reduce the demands on the rotator cuff. Our next topic was shoulder injury prevention. Adele mentioned that it's probably impossible to prevent traumatic shoulder injuries and that she mainly tries to make her athletes as robust as possible. On the other hand, there is evidence from a study of Asker et al. In 2022 who showed that a shoulder injury prevention program was able to significantly reduce shoulder injuries in male handball players. Comparable results were found for the FIFA 11 Plus shoulder injury prevention program. Regarding warm-up, Adele explained that she's a fan of exercises that target the rotator cuff, which don't require lots of equipment. For her contact athletes, bear crawls are a great exercise to get some proprioceptive feedback. When it comes to injury prevention programs, Adele mentioned a lot of caveats. On the one hand, the literature is quite mixed when it comes to deficits that might be risk factors for injury. On the other hand, it depends a lot on the equipment that is available to the therapist. She also stressed that many measurements are not reliable. In summary, her advice would be to assess a few baseline values, and when an athlete gets injured, you have got the baseline values to work towards. Next, we talked about acromioclavicular injuries and acromioclavicular joint dislocations, in particular, where the ligaments that connect the clavicle with the scapula are disrupted. In these cases, Adele explained that the cuff is usually okay, but that she focuses on the scapula to take load. Therefore, she focuses on upward rotation, protraction and retraction exercises. The other big player in these injuries are the upper trapezius, which inserts into the posterior part of the clavicle, as well as the front deltoid, which inserts into the anterior part of the clavicle. Together, they blend into the capsule of the acromioclavicular ligament, helping with stability. She stressed that pull work in these patients should precede any push work, which is often provoking in these patients. Our next topic was return to sport, in particular for contact athletes with traumatic dislocations. Adele explained that they assess rotational strength of the shoulder with an isokinetic machine. She also stressed that it's important to look at the peak torque, the mid-range, and especially the inner and outer ranges of the shoulder. The second thing they look at are performance tests, where they assess parameters like peak force and impulse on press activities, for example. Literature shows that the biggest deficits are often found on these tests 4 to 6 months post-surgery. Other things that her group assesses are joint position sense and lower limb jumps. At last, we spoke about return to play versus return to performance. Edel stressed that psychological readiness is a very important factor to take into account. In her research cohort, psychological readiness dropped at 4 months post-shoulder stabilization, a time when many athletes return to play. Alright, so this was a brief summary of podcast episode 68 on the athletic shoulder with Edel Fanning. I hope I could raise your curiosity to listen to the whole episode, and if you would like to have more resources, download our Physiotutors app to listen to the podcast episode in your own language and get access to the transcript and infographics. As always, thanks a lot for watching, and I'll see you in another video. Bye.